very excited to introduce this person I've had the privilege of interviewing. She is my Girl Scout troop leader since kindergarten, and she is Dr. Ann Anderson Berry with both the MD and PhD title. So, right now, she serves as a tenured professor at the University of Nebraska Medical Center and is the vice chair in the Department of Pediatrics there. And on top of that, she is the executive director of the Child Health Research Institute for the University of Nebraska System and the vice president of research at Children's Nebraska. And if all that wasn't enough, she also holds many roles in nonprofit organizations in our community. And so it's incredible how much Dr. Berry does. That's always been something that's always amazed me since I was younger, because she, on top of being a doctor, she was also our troop leader. And so she would be helping, set up meetings, activities for us to do. And that just takes a lot of time, but she always found time in her day to make sure she could tackle all of these different activities on top of her job. And so I wanted to know, because she's not just leading a clinical team, she also has a research team for lab research. And so I couldn't help but wonder, did she always know she wanted to pursue these kinds of leadership roles of leading all these different teams? And she kind of surprised me with her answer, because she said she never set out to be a leader. Instead, she set out to make an impact, which is a huge difference, because she found all these gaps. She found these gaps that she wanted to fill. Like, she wanted to work toward filling them with the skills that she had at the time. And so it was amazing, because that just reiterizes the point that leadership isn't a one size fits all concept. And so Dr. Berry shows that, having these different skills, everybody is different, and it's always to work towards a different goal that each person has. And so for her, that meant honing her skills over the course of her career, which was over 20 years, to address those unmet needs that she saw in her field. And so she said that all these leadership titles, they just came along the way as she grew her skills, as she gained more skills, and that she kind of slowly found herself finding herself in those positions, and that at some point she was like, okay, I'm going to take this training and I am going to take that step forward to become those leaders, and that seeing that I can also make a difference. And so this kind of ties into something that we've been learning in class, that everyone has different strengths and they have different ways they play into those strengths. And so even as us, we can be leaders and play into all the different strengths we have. So whether it's communication, organizations, or problem solving, we each bring something new to the table. And so that kind of goes back to when we had to take that Gallup Strengths Finder in class, and we all found that we all had completely different strengths, that it's very rare to have the same 5 as somebody else, and that goes to show that each of us is unique and each of us can bring something new to the table. And so that's actually an advantage, because that means that different strengths means diverse ways to solve problems. And Dr. Berry says that it's a good thing to have different strengths. People are different, and so that means there are more ways to address problems and solve them. And so she embraces this leadership style that aligns with her strengths, especially in communication and transformation. And so that kind of led us into the next topic of our conversation, and that's where she shared the importance of communication. So she emphasized how critical it was for her to have communication amongst her various leadership roles. So like in the clinical care, research, and managing all those teams together. So one of the first topics we discussed in communication was communication in clinical settings. So for her, she is a doctor. She takes care of NICU babies, and it's a very sensitive area, because more towards being a new parent and having your baby be in the NICU, it can be very difficult. So clear communication is very essential when she's working with parents and when she's working with her large multidisciplinary team. So everyone on that team, from nurses, other doctors, pharmacists, nutritionists, they all need to understand the broader care plan for these patients, the NICU babies, And she also says that communication changes based on her audience. So when she's talking to medical professionals, like the language is more technical. However, when she's communicating to parents who are stressed and frightened, she often switches to a softer, more empathetic tone. And so that also helps build trust with the parent, and so that they can also fully understand what's happening to their child. And in terms of with her research, communication there, she describes this communication as both educational and collaborative. And so she works with graduate students and other trainees. And so that requires her to communicate in a way that teaches and also mentors them, but also in a professional setting as researchers in a lab. And so sometimes she says she'll have to break down complex ideas into a way that her students can understand easily, but it's also able to challenge them as they're still learning and they're trying to gain more knowledge. So she wants it to promote a culture of, as she said, questioning and curiosity. And so she also says it's important for written communication. So, writing and presenting those scientific ideas. And so, in terms of written communication, she says it's important to be clear and concise with what you write. So, she gave an example to me of how she had a graduate student who has to condense all her 3 years worth of research into a 5,000 word page essay. And so that required her student to be clear and concise because she had to choose, she was limited in the number of words, but she had to make sure the words she used were impactful. So this kind of communication demands like precision and the ability to convey like complex ideas or even just simple thoughts in your head in a clear and straightforward manner that is understandable for everyone and able to communicate and send your intentions to others. And so it really struck me the most that it was how adaptable her communication has to be in each setting. So, because each setting is not the same, so each way she communicates with other population groups is changing. And so it revealed several lessons too to me, particularly for leadership and also with leadership, the collaboration and room for personal growth. And so some key takeaways from that conversation on communication was that having communication is the foundation for effective leadership because you need to have strong communication to be able to give instructions that are clear and that build trust and understanding amongst the team and other people that you are communicating with, talking to. And so that kind of goes back to the big picture that leaders must be able to adapt their communication style to like different audiences. So talking to patients' families, the nurses, doctors, or people who are able to understand the technical language, that's very important. And also having that empathy. And then along with that is that adaptability, as Dr. Berry has shown that she can change the way she communicates based on the team that she is working with. So she can shift from technical language from a fellow clinician to a softer, more empathetic tone to a patient's family to make them more understanding or like kind of come to the fact that what's happening going on. And so it's crucial if you're in a leadership role because nothing's ever going to go to plan, and sometimes the way you communicate is not going to be the same for everybody because everybody is different, everybody is unique. So it's important that you have that adaptability to change to whoever you are speaking to. And then she also said, along with speaking and communication, listening is just as important. So, effective communication isn't just about delivering information. So, for her, it's not always about just delivering information to parents' family. Sometimes it's more important to just listen to them because parents will just sometimes need a listening ear. And, sometimes they want somebody to hear them, and it's essential in crafting plans, making decisions. And so when you listen, you hear other people's ideas. And so whether it's a group project or somewhere with other team members, listening also allows for that improvement as a whole. So you can see this person has this idea, I have my ideas, like you're not the only one with ideas. So Dr. Berry definitely did a good job at highlighting the importance of listening. And it's also that once you listen and you communicate, you're able to build trust with each other. And it's able to be like clear, honest, and compassionate. And so for her, for Dr. Barry, being in the NICU, building trust is very important because these parents, she tells is that they're giving their trust that you're going to take care of their child. Like you're going to give them the best quality like of treatment that you can give. And it's not just like they have a choice, but they want to feel like trusted. They want to feel like their baby is in good hands. So for her, trust is very important. So having a leader who can use both skills of communication and also while showing compassion is going to build that and foster that trust with each other. And she says, which is something that really strikes with me, but she says trust is not built through authority, but also through connection. So connecting with others is very important. And so along with that improvement, along with that like importance of written communication, it strengthens the teams and improve outcomes. So like when leaders are clear, open with their ideas and thoughts, and they're also supportive of other members, it kind of brings together a stronger and more cohesive team. So people are going to work better, they're going to be better outcomes. And it's not about like being the loudest voice, it's about listening. And so like Dr. Barry has been very insightful on all of that in terms of communication because it requires so many different skills in being able to communicate, and that she's always trying to better improve and improve these skills of hers. So, like, even if I'm in a group project, I'm not going to try and stick to some skills I have. Like, I would want to learn from my other team members, like skills they might be good, better at, and we can all work on and improve together. So, like our skills improve and we get better ideas and we work as a better team. And so another kind of concept we've learned in class is like different leadership styles, like different ways people can be leaders. And so Dr. Barry was said like if she had to choose a style that best kind of defined her, she would be a servant leader. So like a leader who would put other people's needs before her own personal gain, which is something we've talked about, like trying to like with Benjamin Zander when he is trying to improve his players' skills before his own as a conductor. And so that's also very important because prioritizing the success of the team and their well-being really stood out, that it's also about the team and not just about you yourself. That's what also makes a true leader. And then something I was very curious about was how she balances her work life, which I feel like it's some common question, but it's always one you definitely want to know. But she stressed the importance of prioritizing like self-care, sleep, and health because it's really good to like you can always feel overwhelmed a lot of times. So having that time for yourself and also for other activities is something to always keep in mind. And then something she said that to always keep in mind as a person, no matter where you are, what you're doing, is to be kind. Like, you never know somebody else's situation. So just being kind, it makes you a better person and it can also help other people too. So, I mean, I've taken so many things. Like, I've learned so much from just having this interview with her, and this video is probably not is not enough to like convey all those things, like everything I've learned, but some things I can take away and improve on myself to become a better leader is honing my communication skills, whether it's being vocal about it, like speaking to other people, or even that written communication, and being adaptable and empathetic. So kind of better improving those skills I've already have. And then also having like being an active listener, so listening to other people's ideas, so improving on all those skills, and just trying to build trust with others and create a more cohesive bonding team. So a lot of what she said has been talked about in class, what we've discussed, and it's amazing to see how everything connects together and how everybody is unique, but also that you have your own strength that you can build on and you can also improve over the course of time. So I'm looking forward to seeing how I can better improve my leadership skills. And I am very thankful to have this assignment as an opportunity to interview Dr. Barry. It was very informative and I really loved speaking to her once again. So thank you, and I hope you learn a little bit more about Dr. Barry and her style of leadership.